My name is Abihira Mediatrix Byarhanga. I work with the Uganda Catholic Medical Bureau. I'm glad to be here to talk to you about health issues, but today in particular, we are going to talk about World AIDS Day. I know somebody might say, why now? Because it's always celebrated on 1st December, but because we had a lot of conflicting issues, we had other things. I remember last Tuesday, for those of you who tuned in, we talked about Mpox, and it is still a problem, but we said we should also remind our listeners about the HIV, because HIV and AIDS is the same thing. So on 1st December every year, globally, this day is observed by everyone to commemorate this day. One, to remember the people that have succumbed to AIDS, to encourage those that are living with HIV to take their drugs very well, and also to ensure that people are aware of this deadly disease and get to know what to do. Because the theme was accelerating interventions to end AIDS by 2030. You know, when politicians are putting targets, we also put targets as AIDS to make sure that by 2030 this deadly disease is history. And how can we get there? We can normally get there. We've got three things we normally use. We call them 95, 95, 95. Those are the targets. 95% of the people in our communities, if we know that 95%, that is 95 over 100, know the HIV status. Those that have HIV get to know. That is one which we call the prevention arm. Then of those 95% we have tested and we find that they have got HIV, we put them on treatment so that they don't develop AIDS. Then the third 95 is to ensure that those who have put on treatment take their drugs very well, what we call adherence, and they suppress their HIV. The amount of HIV in their blood is suppressed, is not detectable. So we shall have achieved our 395, 95, 95. So we might want to say, why are you talking about HIV, or why is the day when people are celebrating, warming up for Christmas? HIV is a sexually transmitted disease, like any other sexually transmitted disease. But you also, maybe I want to break this down. It's a sexually transmitted disease, but it can also be got from a mother who is HIV positive and passes it on to her unborn baby, either during pregnancy, during birth, or when she's breastfeeding. So since it's a sexually transmitted disease, because even the mother to get pregnant will have had a sexual act. So we said, as people are warming up for Christmas, they are drinking themselves, I'm sorry to use that word, you don't know the person you are moving about with, you don't know the person you are getting a relationship with. First go and say, can we go and get an HIV test before you do anything? That's why I said, as we celebrate, we should always be mindful that our life matters as well. We don't want to get these new infections. If we are trying to make sure that by 2030 we have 0 infections, we should start now. So those that have the HIV that we have not got to know, who knows, we don't want to meet one of them and they infect you. So make sure that if you are getting into any relationship, for God's sake, don't get into any sexual relationship without knowing the HIV status of the partner you are getting. We always talk of abstaining. Sometimes when you have taken alcohol, when you have excitement, sometimes you don't even remember that word exists. Because as in the medical, yes, we talk of abstaining, yes, but we also encourage you, if you have this person, because actually we have gone very far to even use drugs as a measure of prevention. We've got what we call PrEP. Those are drugs we give you if you know you are at risk, because we have people in our communities that don't care about their lives. We call them key populations. So we give them drugs to make sure that in the event that they get to such issues, they are protected. And in the event that it also happens, because sometimes you get drunk and you are dragged into something you are not supposed to do, please go to a health worker. They will give you what we call PEP, which is post-exposure prophylaxis. You have been exposed to somebody's status you don't know, so they are going to test you. If you are lucky and you go with your sexual partner, They will test both of you, but because we are not sure, because you cannot, especially if one is still in the window period, you will not get the HIV there and then. So we encourage you, if it has happened and it was not intentional, you go to a health worker. In all health centers in this country, these drugs are there and available for free. Because I know when you tell people to go to medical help, they start thinking, what about money? When you did not even think about the money you went to drink. That's what I should remind our people about. As we prepare for Christmas, let's be very, very, very careful about this deadly disease. And so terrible that, and very painful that the new infections right now are in the younger generation, the youth. I've said, remember, we have got the youth, we've got people that did their senior 6 exams. They are now very free out of the stress of homework, prep at night. They are just waiting for results which will come early next year. We don't want the day you are celebrating your results, you already have the HIV. We've got people that did senior 4. For God's sake, let's be mindful of our bodies. And we also have children that were actually born with HIV and they are on drugs and they are doing very well. And these are the boys and girls you are going to start getting into sexual relationship with. So this is why we are saying, if you have to get in any relationship, before you even exchange your telephone contacts, you walk to a health center and you get to know your HIV status. Once you have tested, because we now use the word test and treat. We test you. If you are positive, we put you on treatment immediately, unless you've got what we call other underlying problems. That if you have TB, we shall first give TB drugs for 2 weeks. Then we continue with these drugs which are called ARVs, antiretroviral drugs. Then if you are pregnant and you go for an antenatal and you test, we give you drugs then because we are trying to prevent this fetus you are carrying in your womb for the next 9 months. And we encourage immediately you have discovered that you are pregnant, come for antenatal as soon as possible. The earlier you come, the better. So when you put you on treatment, we encourage you, we tell you, please, when you are taking these drugs, don't take alcohol. But we always say it, and some will even say, but even wine. So anything alcoholic is alcohol. Because when you take these drugs, remember these are drugs you are going to take for the rest of your life. So if you are taking them and you are putting alcohol, you are weakening your liver. And once your liver is weakened, the body starts getting sick. You are weakening your kidneys. We have got people getting kidney failures. We have got people getting liver problems just because some of them are taking these drugs and they are also taking alcohol. They say, but only one bottle not to do harm. You will go for that one bottle, especially if you are in a company with peer pressure. You find before you know it, you have taken 3 or 4. And besides the alcohol destroying your body organs, it is also, there is a likelihood that if you are taking alcohol, you forget to take your medication. And we tell you, once you are taking these medications, they are drugs that are supposed to be taken daily for the rest of your life. I know researchers are not sleeping, they are doing a lot of things. As we talk now, there is an injection which is still, I think they are getting to final stages to make sure that at least people get that injection once or twice a year than taking drugs every day. But because you have not yet got there, but even then, I think you're even better off with these drugs, because the day you take an injection, we shall not pull it out of your blood. So you say, after all the injection is in my body, let me take alcohol. We really don't encourage taking alcohol when you are taking these drugs, because there is a way they destroy your body organs. And at the end of the day, you start blaming drugs instead of blaming your alcohol. You can contract TB without HIV, but most times the chances are that if you are HIV positive, because your body has low immunity, if you are HIV positive and there has been no intervention of giving you drugs, chances of getting TB, we actually call them, in a relationship, the things we call, we are cousins. So TB and HIV are cousins. But it is true you can have TB minus HIV. But most times when, it's rare really to find somebody TB and HIV negative, but they are there. But the majority are those which have HIV. Discordant couple is when you are in a relationship. You have this man and a woman who are in a relationship. So if this man is HIV positive and the woman is HIV negative, that is called a discordant relationship. But that is if you're already in a relationship. But if I worked with Mr. K in a health center because we want to start a relationship. We are not yet a couple. But still, because we are planning to be a couple, we are going to be given results and say, hey, you are positive, the other one is negative. And because you have decided, the medical worker or the counselor will not decide for you. They will only guide you, tell you the advantages and disadvantages. So if you are in a discordant relationship, if you happen to go and test when you are already a couple, you are already married, we are not going to say you separate. We cannot do that. Because one beauty is that today we've got drugs. You remember I talked about PrEP. PrEP is what we call prepare, to prevent. So if you are HIV negative and your wife is positive, you the negative person, we shall give you drugs called PrEP to take. Because you are in a continuous relationship, you are in a home, in a house that there is a bomb that can burst anytime. So for us to avoid that bomb blasting and killing you, we are giving you drugs to protect you. So that's why we call it PrEP. So you take those drugs. But should your wife, since she's also positive, if she's severely suppressed, we normally say you can stop. But we rarely, because we know people's behavior. Today she can be suppressed. I says, after all, they no longer see HIV in my body, and she starts declining. When she declines and the virus multiplies again, then you are still at it. So we encourage you to keep on the PrEP as a prevention measure to make sure that you don't, the other bomb I talked about does not burst. Maybe somebody might want to ask, how does that happen? Because out there are myths, the things that are not facts. People will confuse and tell you because of this blood you cannot. No, that is a myth. It's just by, you can actually say it's by God's grace. It's a chance that one of you is negative and the other one is positive. And the only way to keep you negative is to put you on what I've called PrEP, to make sure that you are prevented. And also ensure that your sexual partner is taking drugs and is adhering to the drugs very well. And maybe the other thing I forgot about is how the mothers pass. I think I mentioned that. The mothers passing HIV to their unborn babies. Yes. Merry Christmas, everyone. To our listeners, keep safe.